As parents, we obsess over scraped knees and fevers, but are we thinking about their mental health? Today on Awkward Conversations, we're confronting the often overlooked topics of mental health and drug prevention in our youth. This is a conversation that every parent, caregiver, teacher, and friend needs to hear. It's a conversation we sometimes avoid, but in this case, silence is not just awkward, it can be downright dangerous. I'm your host, Jodie Sweetin, and we have joining us some amazing guests, including our very special guest co-host today, Dr. Krystal Lewis.
Thank you.
I'm so glad you're here. Dr. Krystal Lewis is a psychologist and researcher at the National Institute of Mental Health with a specific expertise in helping kids with stress and anxiety. You might also remember her from season 2 of Awkward Conversations. So welcome back, Dr. Krystal.
Thank you. I'm excited to be here today.
Yeah, this is going to be great. I'm really excited to have you join us for this conversation. Also joining us is Amy Morin, a psychotherapist, best-selling author, and host of the Mentally Stronger podcast. She has a series of books, including 13 Things Mentally Strong Kids Do, which has sold over 1 million copies and been translated into more than 40 languages. She's practiced therapy for over 20 years, and you may be one of 22 million people who have watched her TED Talk, The Secret of Becoming Mentally Strong. And, how cool is this? Amy lives on a sailboat in the Florida Keys. Amazing. Welcome, Amy.
Thank you so much for having me. I'm excited to be here.
Absolutely. We're really excited to have you join us here for this conversation. We've talked a lot about, obviously, mental health, substance use, how those things are intertwined, but I think understanding that young people who struggle with mental health issues are so much more likely to have issues with substance abuse. How is mental health linked to drug use in teens and tweens?
Yeah, certainly. Mental health significantly impacts a lot of our youth, our children and adolescents, and oftentimes the experience of having symptoms of anxiety or depression, kids are looking for ways to relieve those symptomatology. And so this can lead to self-medicating, using substances. And so there is a close relationship between mental health and substance use.
And things like self-esteem issues, all of that self-medicating, that numbing, and with social media driving up rates of anxiety and depression, it's a perfect storm to really all come together into a huge mental health crisis that our young people are going through right now, which I think we have really seen. Now, stress is something that we often don't acknowledge in young people. I think there's a lot of, oh, you can't be stressed, you're not paying bills, you're not worrying about a mortgage, but stress in young people is really important. It's really important to address. It's really important to acknowledge. So what are some of the things that are stressing out our young people right now? I'd love to hear from both of you on what kind of those things are so that we as parents can keep an eye out for them.
I see kids being stressed from about everything from their grades to their friendship issues to what they're going to wear on Saturday or who they're hanging out with, what to do. And they're dealing with things that a lot of us didn't deal with, like social media. On social media, you can see who's hanging out and what you got left out of and what the cool kids are doing. And so often there's this fear of missing out or thinking that everybody else's life is better than yours, which is something a lot of adults deal with too. But kids often don't have the skills and tools and resources to know what do you do about those feelings or how do you take care of yourself when you're struggling and when you are stressed out.
Yeah, that's so important. And I think for children and adolescents, their world is social, right? And so there's a lot of social pressures that kids are experiencing that lead to stress for them. And it's important to identify those things.
Yeah, and it's really important to acknowledge and be like, I know these things are stressful. And I think kids are so much more exposed to news and what's going on in the world today and take on some of those things and feel, I know my daughters talk about feeling really powerless sometimes about what's going on in the world and their ability to change it and how they're going to rise to meet some of these challenges in their future. Dr. Krystal, this is your specialty, correct? Is dealing with adolescence and stress and things like that. So tell us a little bit about your experience with working with young people in this regard.
Certainly. Over the years, we've seen significant increases in children's expression of anxiety and stress, depression, a lot of mental health symptomatology. And I think it's important to just acknowledge with our kids that they are experiencing a lot of pressures that may come from social media. media, that come from their peers. There's a lot that's happening right now in the world that kids are seeing in the news that's contributing to the experience of stress. And so I think it's really important for us as adults, for parents, as therapists, to really work with kids to help them to identify what their triggers are, what the stresses they're experiencing are, and really come up with plans for how do we cope with stress, right? That's part of what I do in my practice, part of what I help parents do in terms of identifying signs and symptoms in their children.
And so often, parents, we don't even know how to deal with our stress. We don't know how to deal with all of the things that are coming at us in social media and news and all of that every day. So I know I often think about it. If it's overwhelming for me, I can't imagine what it must be like for young people today. And talking about depression and anxiety and some mental health issues and disorders, what are the ones that are most commonly linked to issues with substance abuse? I know all mental health disorders sometimes increase that desire to self-medicate and experimentation, but what are the ones that are most commonly linked with substance use that we can look out for?
Yeah, I think we see a fair amount of youth who have significant anxiety symptomatology, anxiety disorders. We see a lot of self-medicating with kids who have depression. ADHD, we know, is highly linked to substance use with that component of impulsivity. And so, like you mentioned, a lot of the mental health disorders are closely tied to substance use, but these specifically, we see a higher correlation there.
It's such a huge co-occurring issue, and you really can't separate one out from the other. They are very linked in so many regards. The statistics are that 2/3 of all youth with substance use disorders report at least one mental health disorder. These things are so intertwined and really hard to separate from each other. And that's not even other types of mental disorders that show up in like early adulthood, but this is your area of expertise. How do we work on treating both of these things?
Yeah, that's very important. I think when kids know that something is wrong, so they're experiencing symptomatology, they might have high levels of anxiety, they might be feeling sad, they're more likely to seek ways to reduce that symptomatology, which might be through substance use. And when working with youth, it's helpful to really identify what these mental health symptoms are to help provide them with coping strategies.
Got it. And some of the coping strategies are talked about so wonderfully in your book, 13 Things That Mentally Strong People Do, 13 Things That Mentally Strong Kids Do. I would love to hear from you, too, what some of the signs are that you have found in your work, and also how we can help detect these issues before they really spiral out of control.
We know that kids go through phases, so it's normal for kids to go through a different phase, or maybe they test out a new sport, or they decide, I'm going to give up that instrument I played. But when you see bigger behavior changes that last more than 2 weeks, and it might be changes in their sleep habits, changes in their appetites, they start to lose interest in multiple things, their grades might decline, they start hanging out with different kids, or maybe they don't hang out with anybody at all, and they just don't have the same interests and passions, and they might be extra moody, or they might be complaining of being extra tired. And we know that younger people, too, sometimes don't have the language to say, gee, I feel really depressed today, or gosh, I have a lot of anxiety, but instead they make a physical complaint. So it's really common for younger people to say, I have a headache and I have a stomach ache. And they might really have those things, but they might not be able to connect the dots and say, it's because I'm really stressed out or because I'm struggling lately. So to be on the lookout for those things. A lot of doctor's appointments are actually mental health related underneath those physical complaints of not feeling well.
It's so important to listen to our kids. But I also know as a parent, sometimes I'm like, can you clean your room? Oh, my stomach hurts. And those things happen all the time. And I think as a parent, it can become difficult sometimes to go, oh, am I listening? Am I co-signing their excuses? How best to balance that? And parents, you feel like you're not ever quite sure. How do you tell parents what to pay attention to?
Right. It can be difficult to be able to differentiate between normative behaviors that kids might demonstrate and what's leading towards problematic behaviors. And so what I say when I'm working with parents and families, is we looking at the duration. So as we mentioned, how long has this behavior been going on? Looking at the intensity of it. And so is this more of a normative response, right? As we expect, like you mentioned, telling your daughter to clean her room, we're going to get the eye roll. Want to do this, right? Okay, that can be expected, right? But when it seems to be more of a dramatic response that occurs each time, so the intensity of the response. I think these are things we look at: duration, we look at in intensity, and then we look at just interference. How much is this interfering in your family functioning, right? Is this something that happens once in a while, or is this a daily issue that's coming up? And so it's important to look at all of these different areas to determine how much this may be a problem.
Got it. And as well as a family history. I know so many adults are dealing with issues of anxiety and depression or mental health issues, and really paying attention and knowing if those things run in our family, our kids may be more likely to struggle with those things as well. Now, things like feeling sad and withdrawn, self-harm, suicidal ideation, aggressive behavior, difficulty concentrating, intense worries, personality changes, all those things you talked about, are we're going to list those in the notes as well for parents so that they can really take a look and see if their children are dealing with any of those kinds of behaviors. And again, if that duration, intensity, interference is there, those are some signs to look for to get your kids help. But what are some signs of stress in your kids? I know that sometimes depression can present itself one way, but sometimes when our kids are anxious and stressed out, it goes the other direction into some more aggressive behavior or more easily upset or things like that can sometimes also mirror ADHD symptoms. Yeah. Pulling those apart can be difficult. But what are some signs of stress in kids?
Yeah, I think for some kids, we might expect them to be stressed with certain transitions, right? Maybe going into a new school, or if we're moving, and certain behaviors can be expected. But for other kids, right, they may demonstrate exaggerated responses. So when we're looking at signs of stress in kids, what we want to see is, are there changes in their behavior? Again, that are more lasting, not just one-time thing, but have their behaviors changed? Are they verbalizing physiological complaints, right? So they're saying they have headaches. Are they having stomach aches? What are some of the signs that let us know, okay, something may be going on right now with my child? We often might see changes in the way they're performing in school. So kids' world is academics or school. And so if we start to see maybe that they're not performing as well, maybe they're avoiding going to school, and so certain behaviors. So essentially, we need to identify in certain situations whether these are just kind of stressors that they're experiencing, right? Or is this more of a mental health issue? Because
anxiety versus stress can be very similar. Stress you can work through, but an anxiety disorder or consistent anxiety issues are obviously a lot more problematic.
Exactly. Stress can be a response to something that's happening right here in the here and now, right? There's a stressful experience that's occurring. When we're looking at anxiety, it can be more so a worry about an unrealized future, worry about something that has not happened yet. Stress can be like that physiological response to a situation. Anxiety, we'll say, is more of a psychological response. And so the anxiety then is impacting the child's ability to perform their kind of normative duties, right? The anxiety is persistent. The anxiety is getting in the way of the child being able to function as we would expect them to be. And so it's important to be able to look at that differentiation between stress and anxiety.
And Amy, one of the things that you mentioned was when you take your kids to the pediatrician, oftentimes the appointments can have that underlying mental health check-in that kids may or may not be aware of if they're reporting stomach aches, headaches, things, and you take them to the doctor. What else should parents do if they suspect that their child is perhaps self-medicating with drugs and alcohol or is struggling with some mental health issues? What are some of the things that parents can do to really encourage their kids to get the help that they need?
So one thing is to have open conversations about what you're noticing. Don't make any accusations about what you think that they're doing, but instead you can say, I noticed that you have trouble getting up in the morning all of a sudden, and you never struggled with that before. Or I noticed when you get home from school, you're really tired and you take a nap. And then make sure that you are doing a good job taking notes on what you see as well. Sometimes when we try to report it to a doctor, we say, their mood has been off for a while. It's much more helpful if we can say that my child has struggled with sleep for the past 3 weeks and their appetite has been off for about a month. When we can give as many details as possible, that's much more helpful. And I always encourage parents to give kids a few minutes alone with the doctor if possible. Sometimes the doctor will ask questions, and if we're in the room, they're going to say, nope, that's not an issue. But if we give them some private time with the doctor, sometimes they'll open up or at least ask questions of the doctor that they might not ask if we were sitting right there. Sometimes they can say, I have a friend who struggles with something. What should my friend do? They might be more willing to at least ask those questions when we're not standing right there.
Absolutely. I've found that really key. My daughters are 15 and almost 13, and taking them to their pediatrician appointments I know, I'm like, you guys I'll be in here for some of it to express anything that I need to, but then I definitely go, okay, now's your time with the doctor, because I know that sometimes mom's presence is going to make them not maybe share certain things. And I don't take that personally. I think it's always really important to remind parents not to take that personally. Now, talking about substance use and its relation to mental health disorders and what those co-occurring disorders are, how can parents work on treating both of those things at the same time? Because it really is a two-pronged approach. You can't treat one without treating the other.
I think it's important that parents are connected to a provider, a specialist who can work with mental health as well as substance use or abuse issues. And so having a therapist who is well-versed, I think, is important so that we can provide treatment for the underlying symptomatology that's leading into the substance use, right? Once it becomes a problem where it may be an addiction issue, substance misuse, you must address that. However, looking at what else is happening, what else is going on here. And so it might be that more than one provider needs to be involved. Mm-hmm. It might be that the child might need more intensive services. And so there are a lot of great resources out there for parents to be connected to different treatment facilities, treatment providers. As was just mentioned, going on the websites, there's the National Institute of Mental Health as well, has a lot of good information for where to go, where parents can go.
Got it. And also realizing that mental health, it's a spectrum. Mm-hmm. It is not, there are even within a family, you may have more severe cases of anxiety in one child and then in another, and really listening and treating each child individually and respecting what they're going through it's difficult, but it's really important. How can parents support their child's mental health? What are some of the things that, Amy, that you've discussed in your book that help parents support their child's mental health journey and maybe help make them a better ally to their kids while they're struggling with this?
Just talking about mental health on a regular basis is so important, because we talk a lot about physical health, and nobody holds back from telling their kids about healthy food or about exercise. But it's important to talk about what's good for your mental health too, whether that might be, I don't feel like going and doing this thing today, but I'm going to push myself to do it because that's really good for me to do. Or some cases it might be, I'm going to stay home today and take a little bit of a break for my mental health. But normalizing those conversations and then talking about what can you do for your mental health? Might be small things like I practice gratitude, or I go for a walk every evening, or I spend time in nature, I shut my phone off for a little while. Just mentioning those things and then setting up practices so that kids can get involved in that as well. And you mentioned earlier, Jodie, about the spectrum of mental health, and that's for all of us every single day. And for kids to know that we're not either mentally healthy or mentally ill, it's this spectrum, and where you are at noon may be different than where you are when you go to bed, depending on whatever happened throughout the day.
Very true.
And that nobody's crazy, and that if you're struggling with something, it doesn't make you weak or anything like that, but it just means that maybe you need a little more self-care, maybe we need some new strategies to help you, or maybe it rises to the level of needing to talk to a professional, just like we would with a physical health issue. If you have a little scrape on your knee, you take care of it at home. If you have a really big cut, you might have to go to the doctor. And when we normalize those things, then kids know, oh, okay, it's not a huge deal if you have to talk to somebody about it, and it's to be expected, but there's also things we can do at home every day to manage our mental health better too.
And one thing I will say, and that I've noticed that I'm really proud of in my girls' generation and younger generations, is the honesty that they are talking about mental health. So much more. And really the destigmatization, which we've talked about on this show and I've talked about so many times in dealing with substance use and mental health, both of which I have struggled with. But talking about it and openly and honestly really does remove some of the stigma, and there's so many resources out there. But one thing I do hear about, and I'd love to get your opinion on this too and your input, is I know that now with the advent of social media and things like TikTok and Instagram, so much mental health information is being pushed out there. How can parents and young people differentiate between what is actual helpful information and what is just being thrown out there in order to get more likes or follows or things like that? Because there's some great things I found out there, and then I've also seen some things I go, that doesn't sound like a great way to handle that, but it's got 100,000 likes or something. So what are some ways that parents can differentiate between what are good resources online and what may be not helpful to yourself or your young people?
Yeah, it's an important conversation to have. I think there's a lot of misinformation on social media.
No.
But to your point, there's also a lot of great information, and that's where our youth are getting a lot of their information as it relates to mental health and life in general. And so I think for parents, for families, it's important to have open communication about mental health, about substance use, what their kids are looking at on TikTok, right? What they're looking at on Instagram, and how much of that is normative, how much of that is more of just the cultural piece, right? Which sensationalized. How do we tease apart what's accurate information versus not? I think parents should just encourage kids having open conversations with them about what they're looking at, parents approaching this with their teens as well. And I think just generally knowing that there's some information that's going to be really helpful, but where else can we get more relevant and more scientifically backed information? And so if your child does come to you saying, hey, I saw this on Instagram or on TikTok, and there's some doubt behind, oh, we don't know how accurate this is, hey, let's look some of this up together, right? Let's get more information. So we're not just going off of what we're seeing on social media.
And also, we have done an episode on this too about the ability for medications and things like that to be prescribed online, and kids being able to find that. The self-diagnosis that happens so much with social media and things like that. And you may not be wrong about the self-diagnosis, but it doesn't mean that you should be completely treating all of your own symptoms and being like, I definitely have this, and ordering medications online.
And I say that a lot with my teens. There's a reason why I'm a psychologist, why there are doctors out here. These are our specialties, right? So you can bring it to us. Hey, this is what I saw online. But it's important to have the conversations about, does this actually apply to you? And let the professionals really guide you in the direction of maybe a medication might be needed versus not, but not self-medicating until we get that information of what's going on with you.
You're watching Awkward Conversations Season 4.
Saving lives means staying informed. Knowing the dangers of using fake prescription pills can help those you care about and keep our community safe. As a parent, educator, neighbor, or friend, we all play a role in building safe and healthy futures for ourselves and our loved ones. Do your part to take the first step today. Visit GetSmartAboutDrugs.com to access education, prevention, and treatment resources. Fake prescription pills laced with fentanyl are deadly. Be their protector. Be informed. Visit GetSmartAboutDrugs.com.
Welcome back to Awkward Conversations Season 4.
It's just normalizing the conversations
Right.
around substance use, around mental health. You don't want to come from a punitive place or telling kids, don't do this. We know that doesn't work. But just having conversations and, hey, what have you been looking at? Or they might bring things up to you, or what they've seen in movies, social media, all of that. Just using that as a platform to have short discussions, but making it part of what you do, what you might do daily with your kids.
Right. Amy, what are your thoughts on this?
Yeah, I always encourage parents to try to find some credible accounts too. If your kids are on TikTok, it's good to have a TikTok account just so you know what kind of information is out there, even if it's not something you're particularly interested in. But to do a little research on your own and find maybe an organization, a therapist, somebody that you trust is giving out good information, and talk to your kids about the potential of following that. Statistically, studies have found something like 80% of the mental health information on TikTok is not healthy advice. So you want to make sure that we're countering that with some information from a professional who can give kids accurate advice and give them information that we want them to follow. So I think just making sure that we know what kids are doing, giving them some guidance on who they should follow or strategies for how they might determine if something is accurate or not, and just making sure that they're educated about media in general, that there are a lot of things that get overblown and headlines that are exaggerated and things that can take a serious toll on their mental health.
Absolutely. And we have a great episode that talks about social media and mental health with kids. We have one in season 2, and we have one in season 3 of Awkward Conversations. So it's another great resource. And one of the things I also like to talk about, which I know I have struggled with, is demonstrating that unconditional love with teens, particularly when teens are struggling with mental health, particularly when they are struggling with anxiety, depression, stress. I know I am not at my best when I am dealing with that. I know I am not easy to probably be around or to have a conversation with. I know that I tend to lash out. And teens have strong emotions anyway. Everything it's the first time they're feeling things, it's big feelings, it's all of this. What are some tips that parents can do when having these conversations to avoid the pitfalls of maybe taking some of their kids' things that are said to them personally and feeling like they are the responsible for either for their children's feelings, or that their children are lashing out at them, and that screaming back doesn't create that good conversation, it doesn't create bond? What are some ways that parents can really work on that unconditional love and judgment-free parenting when they're dealing with kids who are obviously struggling with some mental health issues?
I think one thing is to work on not taking things personally, knowing that all kids, all teens, they're going to say things to you sometimes that you're the meanest parent ever, you're the only one who doesn't understand.
Yeah.
And to just accept that's part of parenting. And sometimes that means you're being a really good parent. You're saying no, you're setting a boundary, and that's okay. And to recognize that, yeah, there's days when we feel like we don't really have anything left to give, and your kids are asking for more things, or when you're stressed out about work and other things in your life, it's hard to stay calm. But those are all opportunities to say, what do I do to lengthen my own fuse, and how do I model that for my kids? Of, I'm going to go for a walk for a little while before we sit and discuss this again, or I'm just going to go to my room and spend some time by myself to recharge my batteries for a little bit. And looking for all those opportunities and to practice our own self-care so that we can be as good as we can be, but also to make sure that when we make a mistake, come back and just apologize to your kids later. And it's
So
not
important.
a weakness to say that I'm sorry, but you say, gosh, I had a really stressful day. So then when you did that thing or you said that thing and I lost my temper, I'm really sorry that happened. I'm going to work on taking better care of myself, which then teaches kids, yeah, we all make mistakes. But when you own up to your mistake and you try to say how you're going to work on it, that can really go a long way toward kids thinking, my mom or dad think they're perfect, but here's what they
Right.
really do. It's okay to just call it out, point it out, and then apologize to them.
I have really always been grateful that I do that with my girls, because I have now seen at times when they have had a moment when they're like, you're just the worst, or man, slam a door or something. Usually within a couple hours, maybe sometimes if things are a little heated, it's the next morning. But without fail, my girls will come back and say, I'm sorry that I didn't do and I know it's because I have also modeled that behavior where I have lost my mind and then gone back and said, you know what? I had a really stressful day, and all of that was not about you. And I got frustrated because you weren't doing what I asked. And I just didn't have much patience left. So I shouldn't have overreacted. Can you just get the thing done now? And and it has changed the dynamic of my relationship with my daughters, because parents automatically assume that the authoritative, I know everything, I'm perfect, I never apologize, is how it should be. And that really is not a way to build bonds with kids, correct?
Not at all, right? There's no perfect parenting. So to your example, what you're doing is modeling, right? What do you do when you mess up or make a mistake? And so if adults are having these issues, we know that when we see these outbursts in our kids, in our teenagers, it's hard in the moment to deal with that. But again, they don't have the capacity yet to be able to manage it in a way that you might expect an adult can, right? And so you're modeling what to do when you have those strong emotions. You make a mistake, I come back and you're saying, I'm very sorry for yelling at you, right? Or I could have handled this differently.
Yeah.
You're modeling the behavior you want to see in your teen. And ultimately, like you're saying, your girls are doing that same thing, right? They're getting upset, but then a couple hours later, they come out and they're able to have the conversation. And so that's it right there. It's not striving to be the perfect parent, but rather model these appropriate behaviors, because we all mess up, we all make mistakes, and we all get frustrated, and that's normal.
And also showing your kids how to, like, you know what, sometimes you get upset at things and big feelings are okay, and then you do your best and make it right if you took it out on other people. And I'm so grateful that, like you said, there's no perfect parent, but every once in a while I hear that I'm doing something, like, okay, good. So if you're hearing this out there, parents, and you do maybe one or two things that we've talked about, good job. There is no perfect parent.
Exactly.
There's just a present parent. And we talk about this on the show all the time, that it's the bonds, the relationships, the conversations, and the listening, which can be really hard for parents, right? We are so used to being the, let me explain, let me tell you. And once kids start getting a little bit older, it really is more, let me listen to you, 2 ears, one mouth for a reason. And but it's hard. It's hard to listen to our kids' emotions and pain without wanting to solve it, fix it. What are some great ways that parents can work on some of that, like reflective listening and things like that, when their kids are coming to them with problems and stress?
Yeah, I think it's important to just lead with validating how they're feeling. So letting them come to you and talk to you about whatever it is that's going on and saying, I hear you, that sounds really frustrating. And having a response, that's all you need immediately. And then moving into, let's talk about this together, right? Is there a way that we can come up with a solution, but letting them lead? Because like you said, Jodie, parents want to jump in, problem solve, right? And we want to tell them how what they're feeling is wrong, or,
Right.
oh, this is just not a great situation.
Right. You should do this.
Exactly.
You know, and my kids often just go,
Right. That's
sorry,
not
never
what they're
mind.
looking for. Yeah.
Right.
So it's important to be able to just listen, validate their emotions, and then move into, okay, what can we do about this? And sometimes there may be nothing to do. They just want you to listen to them.
Right.
And so if you want to foster that open communication and you want your kids to come to you, it's just important that, again, that they're met with, okay, mom is here, dad is here, right? They're present. I can just talk about whatever's going on, and they feel me, right? They feel my pain. They want to know. It's not, they want to know that what they're feeling is valid, and then you can move through, okay, let's talk further about what's going on.
Now, when you're talking with children who are also dealing with substance use and mental health issues and things like that, how is, because I know myself when I was young and I've struggled with addiction issues and things, sometimes you need them to take action and they're not taking it. And you don't want to force them and overstress them, but you also know that if they continue maybe to lay in bed and miss practice and not do those things, they're going to feel worse. But you don't want to be like, you're getting out of bed and going screaming at them. But you also know that balance of making sure that they show up for their responsibilities while not overwhelming them. You know, if they are, particularly if they're maybe even new in sobriety as young people, or they are struggling with substance use, you know, stressing them out and forcing them to do things is not good, but also allowing them to completely just lay in bed and give in to the depression is also really hard. Now, Amy, I'd love to talk to you about your book, The 13 Things That Mentally Strong People Do, and resilience in particular, because resilience is something that we hear talked about so often in terms of, oh, kids are resilient, whether it's divorce, whether it's COVID. How can parents foster resilience in their children to help protect their mental health and prevent substance misuse before it starts?
Good question, because I do hear that a lot where parents will say kids are resilient, which they are, but they're not born resilient. They're resilient if we teach them how to be. And parents can be really proactive about helping kids build resilience in lots of different ways. Could be as simple as we're going to practice a gratitude strategy around the dinner table every evening. That helps kids look for the good in life, so they know, all right, even though I had a bad day, maybe lunch was really good, or I got to hang out with a friend for a few minutes and we had a great conversation. Looking for the good definitely helps build resilience. But it's also important to make sure that kids are challenging themselves. So whether your child joins drama, or they're in band, or they're in a sports club, just making sure that they're out there doing things so that they can recognize, I'm challenging myself and maybe I'm more competent and capable than I thought that I was. And when kids are confident that they can do hard things, then that happens with life too. All right, I got rejected, but I can handle it. And we want to teach them, yeah, you can deal with difficult circumstances by challenging yourself to do hard things on an everyday basis. And then we teach kids about feelings too. Just helping kids name their feelings goes a long way toward helping them deal with the difficult emotions. A kid who can say, I was embarrassed that I didn't make the team, is going to feel better than the kid who tries to put on the brave face and says, no, I don't care. We want kids to know, no, it's okay to feel all of those uncomfortable feelings. You don't have to stay stuck in them, but you can feel them. And a child that has some sort of meaning and purpose in life, too, is going to be a lot more resilient than a kid who maybe only plays video games and doesn't have friends. Not that there's anything wrong with video games, but we want to make sure kids know there's a reason for me to get out of bed every day and I can contribute something to the planet, whether I just smile at people or I help my neighbor mow the lawn once in a while. Whatever it is, kids who know, yeah, I can make a difference are going to be way more effective at dealing with challenges and whatever life throws their way.
And I know that was a huge struggle during COVID. They couldn't get out to do any of those things to make themselves feel better. They couldn't see their friends to build that community. And I know finding their community, you talked about gaming online or things like that. Young people find their community now online more than ever. And it is important, but it's also important to remember that often those are sort of parasocial relationships that don't really have any sort of give and take, and there's no real emotional connection to them. But also that parents need to understand that sometimes there are. Sometimes these are are real relationships, and that discounting them can also be really isolating to kids. What do you recommend? How do parents make sure that their kids are finding community and finding things, maybe even outside of their direct family unit, but things that their kids are interested in that can help them build up that self-assurance and that self-confidence?
Yeah, I think Amy makes a great point just about building confidence, right, and self-esteem. And so I think it's important for parents to be able to have kids maybe trying a new sport, right, making new friends, doing different activities, taking the child out of the house to engage socially with kids. There's a whole host of research that looks at the importance of self-efficacy, right, that's behind social learning theory, how kids learn and develop their confidence. And so parents need to respect that kids may have some relationships online where they're feeling emotionally connected. However, it's really important that kids have experiences outside of the home. And so it could be through all types of activities, getting them involved in school, in theater, right? Different types of events like that, and giving them opportunities to master new skills to build their overall confidence and efficacy.
Absolutely. And also I find too, scheduling time off, I'm terrible at doing it for myself, but I have, through my struggles with mental health and pandemic and all of that, I have learned, I need time to recharge. Yes. And this is actually really important for me, and making sure that I schedule it for myself, and that also, there are times for my kids, because my kids are in theater, and one plays club soccer and travels, and one was in high school, and there's all sorts of things going on, Girl Scouts and et cetera. But making sure that I tell them some days, I'm like, today is just a nothing day. We're not doing, get in the craft closet, find stuff in your room. Maybe you're going to be a little bored. You'll live. Today is a day off. Exactly. Today is a day off. And we all need those. And I try and remember that the overscheduling of kids also really stresses them out.
Yeah, exactly.
Speaking of being stressed and going through all of this, Dr. Krystal, you have a great breathing exercise that you do that I would really love, for you to demonstrate. I believe we did this last season. Yeah, we did it, and we did it online. So I'm so excited to be here in person now and get to do a lovely little guided meditation, which is so helpful to help reset yourself, to reset your kids. I have meditated with my kids often right before bed. They both struggle with going to sleep. So meditation has been huge in our house. And I think it can really be changing for parents and their kids, both individually and for their relationships. So I would love to have you take us through a guided meditation to end the show today. And I really encourage all of the people watching, our audience, our crew. I'm looking at all you guys. I want to really take part in this meditation and we could all use a little centering. I know I do it sometimes midday. I'll be like, give me 5 minutes. Dr. Krystal, please take it away, and let's end this episode on a nice, calm, relaxing note.
Certainly. Okay, so there are many different ways to do this, but what we're going to do today is just a brief guided visualization. And more recently, I've done some travels, and I'm going to picture a beach in Bali.
Yes.
You can picture whatever beach comes to mind, but I'll try to make it as vivid as possible for you. So essentially, get yourself in a comfortable position. Try to have both feet on the ground. And what we're going to start to do is take some slow, deep breaths in and out. And so you'll inhale through your nose and exhale through your mouth. Take another inhale through your nose and exhale through your mouth. And as you're doing this, bring your attention to your breath. Bring your attention to the air that's flowing through your nose. Inhale and exhale through your mouth. And now as you're breathing at the slow pace, bring yourself to a beautiful beach. So we're going to picture ourselves walking on the beach right now. Exhale. Now as we're walking on this beach, we're looking out over the water and we see bright blue skies. Inhale. Exhale. And we see some clouds in the sky, but it's primarily nice and sunny. You feel the heat from that sun on your shoulders. Feel the heat on your face. And as you're walking along the beach, you can hear the sounds of the water coming up on shore Hear the ocean water coming, and you're close enough where it's just grazing your feet. Feel the coolness of the water on your feet as you're continuing to walk down the beach. Inhale and exhale. And as you're walking along this beach with a nice bright blue sky, in the distance, some birds flying about. They look tropical. And you're walking, breathing slowly. And across the horizon, you see some mountains, far enough off in the distance, but giving it a beautiful backdrop. So you have your blue sky, the mountains, and you see some birds flying about. Inhale, exhale. And as you're walking, you feel your body relaxed. You feel your muscles relaxed. There's a looseness as you're walking. You're feeling calm. Inhale and exhale. As long as possible. Inhale and exhale. And as you're walking along the beach, you might have a nice cool drink in your hand. Fill your cup with whatever you want. Inhale, exhale. Now, as you're preparing to bring yourself back into this present moment, make sure your breathing remains slow and controlled. Inhale, exhale. Get your last looks of this beautiful sky and the crystal clear water. Inhale, exhale. And now when you feel ready, you're going to start to open your eyes and bring yourself back into the room. Inhale again. Exhale. And once you open your eyes, pay attention to how light your body feels. Your muscles should be relaxed. And we're back here. Try to keep that relaxed state as long as possible.
I think I meditated so deeply, I need to go wipe the sand off my feet. Thank you so much, Dr. Krystal. This has been a really wonderful and important conversation. Amy Morin, thank you so much for joining us today.
Thank you so much for having me here as well.
Amy, I would love to give you a chance to talk about your books. I know there's a series of them. There's workbooks, all of this. Please tell parents and caregivers what is out there for them to read, both for themselves and for their young people.
Sure. I have a series of 5 books on mental strength, starting with 13 Things Mentally Strong People Don't Do. There's also a parenting book called 13 Things Mentally Strong Parents Don't Do. And we have a book for kids. It's appropriate for tweens and teens, and it's called 13 Things Strong Kids Do. And in addition to that, I also have a podcast called Mentally Stronger with therapist Amy Morin, where we offer mental strength tips every single week.
Fantastic. And again, those links will all be in the show notes. I am going to be purchasing some of those books and studying up. I'm looking for all the help I can get. And remember, at the base of all of this is conversations, then normalizing those awkward conversations and keeping those relationships and those bonds strong. So thank you for joining us today on another episode of Awkward Conversations. That's all for now. Tune in next week for more of Awkward Conversations Season 4. Today on Awkward Conversations, we will discuss the critical importance of keeping your home prescription safe, educating yourself and your kids on the dangers of prescription drugs when misused, and how to properly dispose of them.
Having conversations around the importance of keeping medications safe and stored and only using meds that have been prescribed to you by a doctor, received at a pharmacy, not from a friend or your aunt or uncle or someone online, but from a licensed physician.
Make sure that there's a lockable storage container. But we want to talk to our kids and we want to educate them. We want to talk to them about facts, not fear. So if a parent needs to practice and prep what they're going to say before they have that conversation with children, we recommend that.
As a parent, I would say do your homework. There are resources out there to help guide those conversations with your child at any age.
Yes, people need medication, but they shouldn't be taking other people's medication. It's not candy. They shouldn't be using someone else's medication. And that, of course, is always an appropriate time and location for them to have that conversation. not as they're running out the door, not as they're running in the door.
This is an opportunity to teach our kids that self-medicating is not a helpful thing.
Make sure to check out getsmartaboutdrugs.com. Parents, caregivers, you can find so many resources of great information there about how to talk to your kids and make these conversations a little less awkward. A huge thank you to the Elks DAP, which is the largest all-volunteer nationwide drug awareness program, and also a huge thanks to the DEA for their outreach program and for making this possible.
The views, information, or opinions expressed during the Awkward Conversation series are solely those of the individuals, speakers, commentators, experts, and/or hosts involved, and do not necessarily reflect nor represent those of the production, associates, or broadcaster, or any of its employees. Production is not responsible and does not verify for accuracy any of the information contained in the series available for viewing. The primary purpose of this series is to educate and inform. This series does not constitute medical or other professional advice or services. This series is available for private, non-commercial use only. The production, broadcaster, or its channel cannot be held accountable for all or any views expressed during this program.